people experiencing gender dysphoria. They said it's important that there is adequate person-centered care for the mental health needs of these patients. They recommend comprehensive assessment and say that it's crucial regarding mental illness and a thorough assessment of the personal and family history. Why? Because you're certain to find issues in both. Sweden, 2019, the National Council for Medical Ethics, joined by their National Pediatrics Association, petitioned the Ministry of Social Affairs for a comprehensive review of the scientific literature and of the entire practice of gender affirmation, including side effects, unintended consequences, regret, desistance, whatnot. And they got it. In 2019, what's called the Swedish Agency for Health Technology Assessment and Assessment of Social Services did that comprehensive literature review. They found few studies on gender-affirming surgery in minors, so how can you recommend it? Few studies on long-term effects, and they said almost all the studies they did find were simply observational, with no relevant randomized controlled trials in children and adolescents that were found. So Sweden's Karolinska University Hospital and their component Astrid Lindgren Children's Hospital did a complete turnaround of policy effective April 1st of 2021. As of then, hormonal treatments, both puberty blockers and cross-sex hormones, would no longer be allowed under 16. Under 18, it would only be allowed under very tightly regulated studies. Strong emphasis recommended here again on psychological and psychiatric care for everybody under 18. And they cited this: these treatments are potentially fraught with extensive and irreversible adverse consequences, such as cardiovascular disease, by which they mean heart attacks and strokes, osteoporosis, infertility, increased cancer risk, and thrombosis, by which they mean blood clots. Now, switch over to the United Kingdom, 2019, the Royal College of General Practitioners published a commentary complaining of what they call the significant lack of robust and comprehensive evidence around the outcomes, side effects, and unintended consequences of this whole gender affirmation thing. Again, Professor Michael Biggs in his critique in 2019. Then this controversy that hit the press in 2019, this UK Tavistock Gender Identity Development Service, or GIDS, again, the world's largest pediatric gender clinic, had 35 psychologists quit. They resigned over a 3-year period. The reason they gave was the overprescribing of medicalization of kids with gender dysphoria, with psychologists unable to properly assess patients over fears that they would be branded as transphobic. One of them said, "We fear that we have had a front row seat to a medical scandal." I list for you here in my notes several different articles that appeared that time. Then in the UK, there's this National Institute for Health and Care Excellence, which goes by the acronym NICE. So there was the NICE review in 2020 of gonadotropin-releasing hormone agonists, or puberty blockers, and the NICE review of gender-affirming hormones, cross-sex hormones. NICE 1 and NICE 2, as they're kind of known. So the one on puberty blockers said the results of studies in children and adolescents with gender dysphoria that they found were of very low certainty using modified grade. Very bad evidence. You can't make decisions based on these results. And even so, they suggested little change happened with puberty blocking agents. The NICE review on gender-affirming hormones said this: the studies they looked at, and again, this was the world's most comprehensive review, all results were of very low quality using this modified grade system. Shortly thereafter, the Bell versus Tavistock decision in a UK High Court, December of 2020. You ought to read it. It's easy to read and understand. They wrote it that way. They ruled that puberty blockers and cross-sex hormones constituted experimental treatments with limited evidence for efficacy and safety, which could no longer be given to kids under 16 without a court order. And they suggested the same should be true for everyone under 18. And then this particular quote: "There is no age-appropriate way to explain to many of these children what losing their fertility or full sexual function might mean to them in later years." Now, that has been appealed, but the litigation continues. The simple way I have of describing that: say we had a room full of 15-year-olds. We ask them, "Hey, do you want to get married and have kids?" Well, you get one answer. Ask them again at 25. Ask them again at 30. The 15-year-old has no way of projecting what these things mean in the future. So to ask a kid if it's okay that you give up your sexual function and fertility, they're not competent to answer that. Then came, within weeks of the decision in Bell versus Tavistock, the NHS setting forth amendments to their GIDS center that would be in line with it. Then this Cass review done by Professor Cass, former head of the Royal College of Pediatricians, if I understand that correctly. It was released earlier this year, and this was just the interim report. And it led to the closing down of the world's largest pediatric gender identity clinic to be reopened next year under a totally different arrangement, a multi-center model, not just one, strong emphasis on sound documentation of diagnoses, because they found that wasn't happening in the record, strong emphasis on social and psychological support, both for the patient and family, and particular attention to neurodevelopmental issues with the clear documentation of informed consent. The NHS also this year, just in October, released interim service specifications, kind of the new way they want the thing to work. Number one, strong emphasis on mental health. Yet again, this gets repeated again and again and again when you really look at the data. Specialty teams led by a pediatrician with experts also in neurodisability and mental health, addressing a broader range of medical conditions in addition to gender dysphoria. They would recognize now that social transitioning, well, what's that? When you change your name, your clothes, your makeup, you present yourself as the opposite sex, something anybody can do in a day. That even social transitioning should be viewed as an active intervention that has consequences for the child. Understanding that desistance is how most of this will work out for most of the kids. It desists into adolescence. And then for endocrine interventions, meaning for hormone therapies, and I quote, NHS England will only commission puberty blockers in the context of a formal research protocol. Switch over to Finland. Cohere Finland is the Council for Choices in Healthcare in Finland. It's a division of government. And in 2020, they likewise did a full 180. So you have these three nations that were, lead chargers on the whole idea of gender-affirming therapy, completely changing their minds when they reviewed the data. In their case, again, significant reversal. Once again, strong emphasis on mental health evaluation and treatment. They specified the need to recognize childhood phases and fads. We're not going to chemically sterilize and surgically mutilate a kid on the basis of a fad. And complete prohibition of surgery in minors, as is the case in Sweden, as is the case in the UK. France, this year, l'Académie nationale de médecine released a press release, both in English and French, so I think it's significant when the French publish something in English too, where they're noticing the gender transidentity in children and the explosion of it. Again, they recommended psychological support for as long as possible for children, adolescents, and their parents. Again, that this should be done in a multidisciplinary framework, not just one specialist throwing a kid down the affirmation way. Promotion of ethical research, as they call it, and cautioning the parents that they need to have strong vigilance to understand the underlying, what they call addictive nature of social networks that are both harmful to the psychological development of young people and, they say, responsible in large part for this growing trend of gender incongruence. So basically they're saying you better watch what social media your kid's on, because that cell phone can sink them. United States, where we're from. WPATH, the World Professional Association for Transgender Health, and their guidelines, their so-called standard of care. SOC7 was replaced by SOC8 this year. But WPATH, which is referred to by hospitals and organizations and everybody doing, gender-affirming therapy, it's an advocacy group. It is not medical. It is not scientific. And just because they call their SOC8 standards of care does not make it so. It's a sales pitch, it's marketing, and it's too widely believed. Now, the Endocrine Society, as you heard Dr. Van Meter say, in 2017, they were the first actual medical organization to release guidelines that supported, to a limited extent, the gender affirmation model in minors, but it's popularly misquoted. They themselves said in the guidelines that the medical evidence rating for puberty blockers and cross-sex hormones, even in selected minors, was low, and that the medical evidence for adult genital surgery, very low. And this disclaimer on page 3895, the guidelines cannot guarantee any specific outcome, nor do they establish a standard of care. And yet I hear this widely misquoted as being the standard of care in legislative meetings and whatnot. The American Academy of Pediatrics 2018 policy statement is the most radical, the most aggressively pro-transition statement, because it was written in partnership with Human Rights Campaign, the nation's largest LGBT group, but it's an activist group. It's not a medical organization. It's not a legal one. Professor James Cantor published a searing critique of the AAP protocol. He said the AAP statement is a systematic exclusion and misrepresentation of entire literatures. They say not only did they get it backwards, they misquote the citations they make to support themselves. And there's evidence that the AAP is directly suppressing opposition, as evidenced with this Resolution 27 that came up 2 years in a row, and they ignored it both times. So as for these medical organizations that go with the WPATH guidelines, if you will, those decisions and policies are not voted on by the members. They may say, oh, 66,000 members of the AAP agree. No, they never got a vote. These organizations, they pass these guidelines and these recommendations. It's just a small group of people on top, a few dozen at the most. And the members find out about the guidelines when they read about it in the newspapers like everybody else. Now, there's numerous American medical organizations that do not support transition in minors, but you're not going to hear about them in the media. And there's growing opposition to transition affirmation in minors happening on state levels. Numerous states, over 20 of them, have passed what's called SAFE Acts. SAFE stands for Save Adolescents from Experimentation. We have been involved in helping several states craft those. The Florida Department of Health guidelines in April specifically advised against social transition, puberty blocking, hormone therapy, and surgery in minors, all 4 levels of transition. Strong emphasis on mental health was recommended. The reasons are listed why. The Florida Department of Medicaid made effective a rule this summer. Medicaid is government-assisted medicine, for the disabled and the poor and whatnot. And about 5 million people in the state of Florida are on it. This new rule that Florida would not pay for gender-affirming interventions in either children or in adults, and why is listed there. Several of us had a hand in assisting them with that as consultants, and part of their 233-page document to provide the scientific evidence was an actual comprehensive study done by 2 experts from a Canadian university who had no vested interest in the subject, and they too found that the literature was of very low quality. And Florida Medicaid rule has already withstood a court challenge. And then the Florida Board of Medicine, separate and distinct, their legislative committee just in October, a ban on all transition affirmation in minors. So, though it may be a surprise to you, Northern Europe is leading the charge against these transition-affirming medical intervention with these decisions that have happened in the UK, Sweden, Finland. The French medical organizations are starting to come on board, and there's strong pushback happening in parts of the United States, particularly in the state of Florida. And I think this is the wave of the future. Thank you for your attention.
Thank you. Thank you very much. And I think it's already become quite clear there is simply no data on what they could possibly base these decisions and justify these actions on. Yeah, I would now like to give the floor to Ms. Laura Haynes, please.
It's an honor to be with you. I'm Dr. Laura Haynes, a psychologist from the United States of America. I have served as an expert on gender research for professional organizations, members of parliaments, courts, United Nations delegates, and high-level government officials. Next slide. A few definitions. Sex is the reproductive path of a person's body toward contributing an egg or sperm toward reproduction. Gender identity is the sex a person feels or perceives that they are. Transgender identity or incongruent gender identity or trans identity is a gender identity that is in conflict with a person's sex. For example, a girl feels I'm a boy, or a boy feels I'm a girl, or I'm both boy and a girl, or neither, or something else. Gender dysphoria is a feeling of distress or unhappiness or anxiety that some people feel when their body does not match their perceived sex. Gender identity is different from sexual orientation or sexual attraction, which is the sex or gender identity for which a person feels romantic or sexual attraction. Gender transition or transing is the process of getting treatments for gender dysphoria toward making the person's body appear more like their gender identity, such as using puberty blockers, cross-sex hormones, surgeries to remove healthy breasts, or sex organ surgeries. These medical interventions on the bodies of children and adolescents is not a good idea. Transing kids is a bad idea, and there are at least 3 reasons why. The first reason is gender identity is not a biological thing. It's not inborn or who somebody biologically is. At least 14 professional organizations agree trans identity has social environmental causes. It's not just biologically caused by genes, hormones, or brain structures. And these, the next slide is the references for the 14 organizations and what they say. Next slide. A global consensus statement by endocrine societies around the world says gender incongruence is not caused by having the brain of the opposite sex. They said there's no consistent evidence that brain structures are different for gender incongruent people and gender congruent people. They said there's no biological marker for gender identity. That means there's no biological thing that has been found that another person can find by looking at a person's brain or doing a biological test. They said gender identity development is complex and biopsychosocial. That means it develops from a complex interaction of biological and psychological and social influences. And I list the endocrine societies that made this global consensus statement from around the world. Next slide. The American Psychiatric Association says that scientific evidence does not support that gender dysphoria is intersex of the brain. They say this in their diagnostic and statistical manual. They said biological factors are seen as contributing in interaction with social and psychological factors to gender development. And they said that overall current evidence is insufficient to label gender dysphoria as a form of intersexuality limited to the brain. The Swedish and United Kingdom government treatment recommendations call for using this manual for diagnosing gender dysphoria. This is the current 2022 manual that says this. A second reason that transing kids is a bad idea is that psychiatric conditions commonly start before gender incongruence starts and may be causing it. Sterilizing kids with experimental treatments does not treat psychiatric conditions. Psychiatric treatment does. High rates of psychiatric conditions, such as psychiatric disorders, neurodevelopmental disabilities, self-injuring behavior, or suicidality, have been found in gender incongruent adolescents and adults in many countries, including at least 10 European countries. This is widely accepted and not controversial. But the question remains, which comes first? Psychiatric conditions or gender dysphoria? A U.S. study looked at all the gender incongruent identity children and adolescents in a health maintenance organization in the states of California and Georgia over 8 years. And looking at the medical record evidence, they found high prevalence of lifetime psychiatric conditions before first evidence of gender nonconformity for children ages 3 to 9 and adolescents ages 10 to 17, compared to their peers who accept and identify with their sex. For children, a third of the children, about 33%, had psychiatric disorders before gender dysphoria evidence. And adolescents usually had psychiatric disorders before the evidence of onset of gender dysphoria, close to 3/4 of them. And by comparison, the children who identify with their sex, a very tiny percent had lifetime psychiatric disorders. In Finland, researchers looked at all the adolescents in one of their 2 centralized gender clinics over 2 years, and they found 75% had psychiatric conditions, commonly severe, and commonly starting before adolescent gender dysphoria, seldom starting after. The vast majority suffered significant psychopathology and broader identity confusion than gender issues alone. So they were confused about their identity in many areas and ways, not just about their gender. What is causing these psychiatric conditions? We want to know, have they experienced adverse childhood experiences? An Australian hospital gender clinic looked at the children and adolescents ages 8 to 15 who came through their clinic over 5 years. They said the developmental stories told by the children and their families highlighted high rates of adverse childhood experiences. 89% of the children had psychiatric disorders or conditions. 14% had autism. 98% had adverse childhood experiences. On average, 5 of them, usually in the family. These included family conflict, loss by separation from a parent or grandparent, mother mental illness, father mental illness, bullying, and almost 2/3 experienced maltreatment in the forms of such as exposure to violence between spouses and partners, emotional, physical, or sexual abuse. The families did not think they were troubled. They saw the gender dysphoria as an isolated problem. The multidisciplinary staff felt pressure from the families to go down the scientifically unsupported medical path of puberty blockers, cross-sex hormones, removing healthy breasts, and potentially sex organ surgeries, rather than give thoughtful psychiatric care. And the medical professionals were fearful under this pressure. An early classic research review by Zucker and Bradley found that incongruent gender identity develops when a child who has a sensitive or vulnerable temperament is in a troubled family and comes to perceive that the opposite sex is more valued or secure. The child's solution is a fantasized opposite sex self and cross-sex behavior. An opposite sex parent or grandparent may encourage this. Finland's government treatment recommendation for adolescent gender distress says, since reduction of psychiatric symptoms cannot be achieved with hormonal and surgical interventions, it is not a valid justification for gender reassignment. The first-line treatment for gender dysphoria includes treatment of possible comorbid disorders that may predispose a young person to the onset of gender dysphoria. The governments of Finland, Sweden, and the United Kingdom are restricting transing kids and prioritizing psychiatric treatment. Medically transing kids neglects treating psychiatric causes and is a bad idea. These are the references for the previous slide. The third reason that transing kids is a bad idea is that trans identity may not last, but the harms to the body of transing kids may last a lifetime. Childhood gender dysphoria naturally, spontaneously resolves if incongruent gender identity is not affirmed. If you do nothing or support them to go through puberty, about 85% of children will just outgrow it by adulthood, according to 11 out of 11 studies and at least 9 professional organizations. Some children who were interviewed said what helped them was that when they experienced puberty, those natural sex hormones and body changes help them to feel, to identify with their sex and feel happy about it. But if you affirm or give social transition to children, that is, you allow them to live as another sex, with cross-sex clothes, names, and pronouns, only about 2.5% will outgrow their gender dysphoria, maybe up to 11%. And if they do outgrow it, at this point, they'll have to go through a second transition back to living as their sex and their name and clothes and so on, and that they had before. And this is embarrassing and painful for a child to go through with their family, their friends, their school, their society, everyone around them. Nowadays in school, many children are told when they're 5 years old, if not earlier, that they can create their gender identity. But children may be able to say at age 2 or 3, I'm a boy or I'm a girl. But they're still developing their concept of what gender means until some of them age 7 or even older. So their concept of gender is immature. And as we know, some of them have psychiatric disorders. So telling children, young children, they can create their gender identity is a bad idea. Then they're given, if they say that they do create a gender identity, transgender identity, or incongruent gender identity, or they say they're confused, they are a Q, they're questioning, then they're allowed to have, or even supported to use cross-sex hormones, clothes, cross-sex, not hormones yet, cross-sex clothes, name, and pronouns, which we know will lock them in. That's a bad idea. And then they are given puberty blockers, which will deprive them of their natural sex hormones and body changes. That's a bad idea. And we know that puberty blockers may cause or worsen psychiatric disorders. That's a bad idea. And we know that once children are on puberty blockers, they're not just having time to pause and think about where they want to go. They've already been reinforced to go ahead. And so 0 to 6% will outgrow their gender dysphoria and go on to have cross-sex hormones and be sterilized for life. Their genitals will remain at child size and functioning forever. Their capacity for sexual pleasure and functioning is affected. The puberty blockers and hormones are risky. They risk their physical health, and they'll have to be medical patients for life. All of this is scientifically unsupported. Their psychiatric conditions continue, and their suicidality risks long-term are high. This transing kids is a bad idea. There are 4 slides now for the references for this chart that I just showed you. Trans identity in adolescents and adults also may not last. The government recommendations in Sweden, Finland, and the United Kingdom say gender identity changes in adolescents and youths. In Sweden's treatment recommendation says gender identity formation is an evolving process in youth. Finland's government treatment recommendation says gender dysphoria may reflect the temporary search for identity typical of the developmental stage of adolescence and may subside. Sweden, the United Kingdom, and Finland in their treatment recommendations for these governments say are taking seriously that youths are changing their minds and regretting medical transition. Emerging research on detransitioners in Western nations has found people detransitioned at ages 14 to 64 through the lifespan. The average age of transition was just before age 18, and the average age of detransition was 4 years later at age 22. The Adolescent identity, trans identity in adolescents and young adults may not last, but the harm to their bodies still lasts a lifetime. And here are the references. Transing kids is a bad idea for at least 3 reasons. 1, gender identity is not a biological thing. It's not inborn or who someone biologically is. 2, psychiatric conditions commonly start before gender incongruent identity starts and may be causing it. Sterilizing kids with experimental treatments does not treat psychiatric conditions. Psychiatric treatment does. And 3, trans identity may not last, but the body harms of transing kids may last a lifetime. Thank you.
Thank you very much. That is a lot to take in, I have to admit that. I would now like to give Jeff Haynes the floor. He is one of the online participants. Hansen, I'm sorry, Jeff Hansen.
Can you hear me? Here I am.
Yes.
So thank you for dear colleagues and Christine Anderson for having the courage to step up on this most important issue. It is my high honor and privilege to be able to speak to you about the issue of transgender dilemma in the young from the perspective of a boots on the ground clinical pediatric psychologist. If I may, I would love to start with an apology for my psychology profession for contributing to what I call a medical scandal of early affirmative care. As PhDs, it's my belief that we have an obligation to know the research that either supports or fails to support what we do, and sadly, this has not been the case in my profession, and I fear in some others. Next slide, please. My favorite journal, National Geographic, in 2017 published this issue, Gender Revolution. And while many of us may indeed call this a revolution, I think at least for the pediatric and adolescent population, it may be more gender confusion. Next slide, please. So in just a decade, when the DSM-5 was first published in 2013, it was reported the expected incidence of gender dysphoria to be about 0.005 to 0.014 for natal males and 0.002 to 0.003 for natal females. That's only in the thousands. So in just less than 10 years, the incidence of gender dysphoria has increased by a staggering 1,000%. As a CDC study shows, almost 2% of high school students now identify as transgender. That's alarming. Next slide, please. So, referrals to the JID clinic, now defunct, certainly, as previously commented, but from the year 2012 to 2017, you can see the staggering increase in referrals. Next slide, please. So what is gender affirmative therapy? Social transition starts as early as 3 to 4 years of age. Puberty blockers, 10 to 14 or 8 to 13 in girls. Cross-sex hormones as early as 14. Surgical modification as early as 15 to 17, in some cases 14. Next slide, please. So from an early age, our youth are inculcated with graphics such as the gendered person, ostensibly to allow them to understand their gender. Next slide. Which is mutated now to the gender unicorn as it's thought to be more neutral. But as you see, there are 5 dimensions that they must consider: gender identity, gender expression, sex assigned at birth, who they're physically attracted to, who they're emotionally attracted to, and with these 3 subcategories in each of those, male, female, or other. So if you try to consider the permutations, 3 times 3 times 3 times 3 times 3, you come up with 243 different permutations. So that makes my head hurt. How can we understand that as adults? How can a child or adolescent understand that? I don't think they can. Next slide, please. I'd like to thank my colleague and friend, Dr. Mike Laidlaw, endocrinologist in California, for sharing the content of the medical effects of some of these therapies. Next slide, please. So the side effects of a blockade of normal puberty: stunning of penile and testicular growth, sexual dysfunction, and this is in males, impairment of erection, orgasm, ejaculation, prevention of sperm production, fertility, disruption of normal brain development, disruption of normal bone development and strength. In females, a menopause-like state, blockade of normal breast development, decreased blood flow to the vagina and vulva, sexual dysfunction, thinning of the vaginal epithelium, vaginal atrophy, prevention of menses, ovulation, infertility, and also disruption of normal brain development, and finally disruption of normal bone development and strength. Next slide, please. Some of the neuropsychological effects of puberty blockers include emotional ability, mood changes, headaches, nervousness, anxiety, agitation, confusion, delusions, insomnia, depression. Who would want to be on that? And with a warning to monitor for the development of worsening psychiatric symptoms, and not listed here but previously mentioned, suicidality. Use with caution in patients with a history of psychiatric illnesses. Next slide, please. This graph nicely shows the disruption in bone density. So you see it baseline starting, and just going 36 months out, you're about down to the 8th percentile. That's an alarming increase. It certainly sets one up for potential osteoporosis. Next slide, please. The side effects of cross-sex hormones, as previously mentioned, are certainly alarming. In both sexes, there's an increased risk of myocardial infarction and death due to cardiovascular disease, specifically in males on estrogen. Thromboembolism risk goes up 5 times. Gallstones, hypotriglyceridemia, too many fats, breast cancer risk increased by 46-fold. Gynecomastia, sexual dysfunction, infertility. In females on testosterone, erythrocytosis, basically too many red blood cells, severe liver dysfunction, hypertension, breast, uterine, ovarian cancer risk, and hairiness, deepening of the voice. Sexual dysfunction, also infertility. Next slide, please. This slide shows the effects of testosterone. Females on testosterone, those rates are 6 to 100 times higher than endogenous female levels, and you can see that the normal level is surpassed many-fold, and you see it, the levels for an endotumor and the male to female transition are quite high, and it exceeds those rates. Next slide, please. Breast binder harms are not without, certainly need to be mentioned. In a study of chest binding, self-reported complications and side effects have included chest pain, shoulder pain, back pain, shortness of breath, breast tenderness, skin changes, among a multitude of other harms. In another study, it was shown that lung function and chest wall size were also adversely affected. Next slide, please. As mentioned earlier, the classic study came out of Sweden in 2011. This was a long-term study from 1973 to 2003. It included everyone who had surgical reassignment in Sweden, and a staggering 19 times more likely to commit suicide or completed suicide. Next slide, please. So what are the potential causes of this rise in transgender identification? Let's talk about a few. Next slide. Autogynephilia. Dr. Ann Lawrence, the Department of Psychology at the University of Lethbridge in Canada, notes that autogynephilia is defined as a male's propensity to be sexually aroused by the thought of himself as a female. Autogynephilia exemplifies an unusual paraphilic category called erotic target identity inversion, in which men desire to impersonate or turn their bodies into facsimiles of the person or things to which they are sexually attracted. Next slide. Homophobia. Dr. So is a medical researcher out of Canada, now more of a writer. She was actually criticized highly for her points of view, which is often something that happens to people who speak up. Dr. So writes that despite the many strides forward that have been made by the gay rights movement, some children are actually being encouraged to transition as a solution to homophobia. Effeminate sons tend to evoke stronger negative response than tomboy daughters. So Dr. So adds that a greater public awareness about gender dysphoric children and the difficulties and stigma that they would face, parents receive more attention, more woke points, if you will, and admiration when raising a transgender daughter than a gay child. Moreover, for those who are troubled at the thought of having a son who is effeminate, transitioning offers a very elegant solution by allowing that boy to transition. Next slide, please. Well, the hallmark of autism, as many of us know, is concrete thinking. And Dr. Glidden and his colleagues conducted a review of over 58 studies and concluded that There is a considerably higher rate of autism spectrum disorder, ASD, in children and adolescents with gender dysphoria than the general population, about 15%. Both GID and ASD involve a predisposition for obsessional and focused interests and extreme rigidity in thinking, accompanied by intense anxiety if anyone steps in the way. Next slide. The influence of role models. By the way, that's Jazz Jennings. Many of us have followed her, and this is her today. Now obese and certainly clinically depressed. According to Bowman et al., the increase in prevalence of gender dysphoria and gender incongruence in the last decade is most likely due to several interactive link factors, one of which is the increased visibility of accepted trans people in television films such as Caitlyn Jenner, Transparent, Jazz Jennings, and Danish Girl. These individuals enter societal conscience as an increasingly mainstream phenomenon, contribute at least to a partial destigmatization of being trans. Next slide. Childhood trauma, that certainly enters my bailiwick as a clinical psychologist. As trauma expert, Dr. Peter Levine notes in his very excellent book, Healing Trauma, trauma is much about this loss of connection to ourselves, to our bodies, to our families, to others, and to the world around us. Moreover, the long-term consequences of these traumas are tremendous and often lead to a total inability or impaired inability to access appropriate responses to threatening events. This can lead to chronic hyperarousal, intense anxiety, panic, mood instability, poor emotional behavioral regulation, feelings of powerlessness, helplessness, shame, and even immobility. In some individuals, and I think actually many, in a desperate attempt to find an explanation to the overwhelming emotional and even physical pain they feel as a result of trauma, will conclude that it is gender dysphoria that is the root of the pain, and are deeply comforted by this knowledge. We want an answer to what's going on within us. So my problem can be interpreted by gender dysphoria, and if I solve this, it will bring an end to my pain. Next slide. Transgender OCD, also known as TOCD. Clinical social worker Josh Kaplan, who specializes in OCD, notes that individuals with TOCD are focused on trying to know for sure whether their thoughts are a sign of an underlying and unrecognized desire to transition their gender presentation. In this subtype of OCD, in which the person obsesses over their gender identity, these intrusive thoughts cause the person significant amounts of anxiety and uncertainty, which they desperately try to relieve with compulsive behaviors such as emotional checking, memory review, reassurance seeking, and researching. It is important to note that TOCD is not the same thing as gender dysphoria, which transgender people often experience. Next slide, please. Rapid onset gender dysphoria, also known as ROGD, often spoken about in the U.S. today. Dr. So writes that until recently, adolescent onset dysphoria had typically appeared in adolescent males in the form of autogynephilia. On the other hand, rapid onset gender dysphoria, ROGD, is typically seen in teenage girls and is characterized by a sudden and often out of the blue, didn't see it coming onset with no apparent previous history of gender dysphoria at all. Dr. Lisa Littman, an OBGYN physician and assistant professor at Brown University, published one of the first studies on ROGD. This study surveyed 256 parents who completed a 90-question survey, and the results suggested for at least some of these girls, their transgender drive was a function of social contagion. And I certainly see a lot of this in my clinical practice. Next slide, please. Next slide, please. So, basic Littman study results, over 80% were natal females. The vast majority had zero indicators of early childhood dysphoria. About a third of the adolescents did not at all seem gender dysphoric prior to their announcement. Nearly 70% of the teens belonged to a peer group in which at least one friend had also come out as trans, and all of them had come out as trans. Over 65% of teens had increased their social media use, time spent online prior to their trans announcement. And among parents who knew their children's social status and activity, over 60% said their announcement brought on about a popularity boost. And fewer than 13% of parents felt that the adolescent's mental status had improved after transgender identification, and over 47% said that it had actually worsened. Next slide, please. This graphic shows, and we're certainly in a mental health crisis, as alluded to earlier. The top graph, a little hard to see, but it does show you that there's been a staggering increase in suicidality since 2008. This falls it out to 2016 of 30%. Bottom graph shows that there have been increases in depression, major depression across all age groups, with a relative change, spike increase in young folks in particular. Next slide, please. And we'll skip this one. Next slide, please. So a better way for our children. Watchful waiting or wait and see enables a child to guide the course that they will take. They may or may not eventually decide to go forward with transitioning. The therapeutic, an extension of this, the therapeutic approach or the developmental approach allows for the child in question to explore the parameters of their gender while being open to the possibility that he or she might eventually grow comfortable in their sex that they were born as. The therapist would endeavor to understand the possible relevant factors of their development, to include adverse child experiences, as alluded earlier, trauma, another psychopathology, or whatever else might be transpiring in the child that might be moving the child to feel this way. And this is the approach that I take in my practice. I don't specifically address trans issues. I deal with comorbidities. Next slide. As also previously mentioned, support for the wait-and-see approach is dramatic. Studies indicate that approximately 80 to 90% of child onset gender dysphoria resolves by age 20. The majority of these children who have gender dysphoria will be same-sex attracted or bisexual, however. Next slide. And we'll skip this one as well. So I'd like to offer a couple of cases. These are cases that I've treated in my practice. First case, Asperger's disorder, background, 14-year-old teen male, pseudonym Bill, with pronounced Asperger's disorder, seeks male to female transition. Bill looks at his crotch and yells out, "I want it gone," demands that his mother take him to endocrinology to start hormone therapy immediately. His mother, being a crusty senior non-commissioned officer, flat refuses and states, "I will never agree to this, so get your own ass there." Therapist, me, chooses to remain silent and respect mother's position, even though it is a bit harshly stated, to say the least. In follow-up sessions, however, our therapy focused on the issues of anger towards father for losing his job after molesting a woman in an ambulance while serving as a first responder, and then for later refusing potentially life-saving therapies for his cancer. He eventually died. Being male for Bill was possibly quite repulsive. 6 months later, when queried where Bill stood on the transition issue, Bill replied, "I'm over that. It was just a phase." He then talked about his next possible girlfriend. Next slide, please. Case 2, toxically anxious mother. And I just spoke with this young lady just about 4 weeks ago. She's doing fabulous. So a 13-year-old female, pseudonym Jane, identifying as a boy. Jane becomes suicidal, begins self-injuring, develops panic disorder, and is nearly hospitalized. Over the course of therapy, Jane comes to appreciate that she finds her mother, who she dearly loves, toxically anxious, and realizes she does not want to be a woman, as she might likewise become weak and affected like her mother. She prefers to identify instead with her much stronger father. As Jane matures, however, she comes to appreciate that women can in fact be strong and embraces her female gender. Happily, Jane's suicidality, anxiety, have completely resolved, and she's now happily married and is expecting her first child in about, I think, 6 weeks. Next slide, please. Case 3, sister gets dad's adoration. 16-year-old male teen, pseudonym Arthur, seeks male to female transition, is adamant that he start hormone replacement therapy immediately. Arthur is suicidal, self-injuring, rageful. He assaults his father savagely, wields a butcher knife, and stabs a kitchen countertop, and resultantly goes inpatient for 3 months. Among other things, he envies his sister, who is, by his thinking, has a better relationship with her father, as she and father share a common passion for literature. During treatment, Arthur and his father restore their relationship, and they find deeper connection through a mutual love of music. And although Arthur still desires to transition, he agrees with his father's recommendation to wait until his brain is fully developed at age 25 to make any decision to act on his desire to transition. I recently received an email from his father saying that he's now in university enjoying a warm and loving relationship with his parents and sister. Next slide, please. Case 4, weaponized by woke hospital staff. 14-year-old female student Alice seeks female to male transition. She also identifies as a little and a furry. She wants to be anything else but herself. Alice is hospitalized for suicidality, and upon discharge, staff shames, and that was the inpatient staff, parents of Alice in front of her for not being on board with her desired transition, for not using pronouns, and for not, among other things, moving along with her transition desires. Alice immediately makes false allegations against her stepfather, alleging that he molested her. Those were later proven to be false. Military stepfathers removed from the home and faced possible courts-martial, incarceration, and/or dishonorable discharge. Alice is then placed in residential treatment for suicidality. In therapy, she comes to appreciate that she cannot easily identify with her mother, who is rendered incapacitated by a life of trauma in Russia, to include rape and physical abuse, and ends up in a wheelchair. Parents are in great conflict. Alice eventually admits that she lied in hopes to be removed from the family conflict and to be able to transition, as parents were not supportive of a transition. Some of these kids are willing to do anything and everything. They certainly turn on a dime against their parents. And Alice still desires to possibly transition at a later point, but is no longer hostile towards her parents and is in the process of rebuilding trust and connection. So my point is that we can help these children. If we don't jump onto the narrative, we get them time to heal, we understand the causes, what's driving this, we can make great strides. And certainly, the more we can kick the can down the road, they can make that decision later when their brain matures, the better. Thank you so much for your attention.
Yeah, thank you very much. And yeah, now I would like to move on to Walt Heyer. He is also an online participant. Walt?
Are you getting me now?
Yes. Yeah.
Okay. All right, good. What a pleasure and an honor to be able to speak to you for a few minutes. There's been a tremendous amount of excellent presentations by everyone so far, and I'm only going to add to that in this regard. I lived 8 years, the one in the red sweater was me, after having the hormones and surgery. Well, how did I get there? I think that's probably what is important. I was a young boy who was cross-dressing at the age of 4 and was, today they would say affirmed by my grandmother, and cross-dressed in a purple dress. And at the time, I thought it was benign and insignificant, even fun. What I realize now, I'm 82 years old. That was over 77 years ago. And I realized that cross-dressing a boy is actually emotional and psychological child abuse, and is also part of what I call adverse childhood experiences. You know, you're telling a child who's in his earliest developmental stage that there's something wrong with him. I think this is kind of the thing that gets me the most in a personal situation, is that when somebody starts cross-dressing you and affirming you, even if I'm the one who said I wanted to cross-dress, you are telling them there's something wrong with them as a boy. And I think this is part of where the psychological and emotional disorders began to develop when I was 4 years old. And so I moved through this process, and I was sexually abused by my uncle as part of this. Because I was wearing a purple dress, my uncle thought I was fair game to be sexually molested and abused. Without the purple dress, the molestation and abuse never would have taken place. And nor if grandma would have said, you know, you're a boy, you're an excellent looking, handsome boy, and you don't need to be wearing a dress. Wouldn't it be wonderful if Grandma would have affirmed me as a boy so that I didn't turn out wearing this red sweater and living and identifying, changing my birth record, had all the surgery, living that way for 8 years. So, you know, after living as Laura Jensen for 8 years in California, I worked for the federal government at FDIC. I worked for the Postal Service. I had jobs. I wasn't on the street. I began to wonder, can you really change somebody's biological gender sex with hormones and surgery? And at this time, I was beginning to question, as many people do after about 8 years, you're only a transgender until you are not anymore, until you decide to detransition. And so when I challenged my surgeon, Dr. Biber, who had performed by the end of his career 5,000 of these so-called sex change surgeries in Trinidad, Colorado. At the time that he did my surgery, he had performed over 3,000. And so I was in the process of, in late 1989, trying to restore my birth record and had to go to court to do it in California, and asked the good surgeon and the psychologist who approved me for the sex change surgery, his name was Dr. Paul Walker. Dr. Paul Walker was a world-renowned individual who dealt with these issues of gender dysphoria, gender identity disorder, and had actually written the first draft in 1978 or 79 of the Harry Benjamin International Standards of Care. And my therapist was actually the one where that standards of care developed and morphed into what we have now as WPATH. And he was my therapist, and you can see, because I'm standing here talking to you as Walt, that this whole transgender thing kind of fell apart for me. So when I challenged the doctor and the therapist to report to the court, because I wanted to restore my birth certificate, I wanted to know actually what they could report to the court about what surgery and hormones actually did. And so they drafted a document to the Superior Court of California. There's some nice pictures of me as a young kid. And they drafted this testimony to Superior Court of California in San Mateo. And in that document to Superior Court, they testified both, signed by the therapist, Dr. Walker, and Dr. Biber, that you do not, through use of hormones and surgery, no matter how many hormones you take or how much surgery you have, you do not change anyone's gender or sex. That they used a term I hadn't heard before. They said your inner morphology stays the same. The only thing that hormones and surgery does to a child or an adult is neuter them. That means you just make them sterile. You didn't change their gender. And so with that, I began to detransition, which I did in 1990. And then I began to work on a website, sexchangeregret.com. And I wanted to know at the time, because I had thought maybe I was the only one in the entire world that had regret. So when we developed the website, sexchangeregret.com, the first year, it's about 14 years ago, I think we had like 700 people visit the site. By 2015, we had 356,000, and now we've completely surpassed all those numbers, and we're way past the millions. And so people contact me at sexchangeregret.com. And so what I've learned and what I'm going to share with you today not only comes from my own experience, but from the thousands of people who have reached out to me and written notes to me about their regret and their desire to detransition. And they come from all over the world. In fact, I had 2 come from the UK just in the last week. What's really happening here is the individuals who reach out to me with regret, what I always ask them when we get into discussion is, tell me what happened that caused you to not like who you were. And what's interesting about that, of the thousands of people I've worked with, it's one of the first questions I always ask. They always tell me there was an event, an issue, and many of them have been talked about, whether it's, they don't like their dad, they think their dad is a weak person or somebody they don't want to emulate if they're a young man, said, dad is an alcoholic, he's this, he's that, and I don't want to be that. Maybe the issues of the sister gets more attention than I do, so I'm going to transition to a female so that I can get the same level of attention as my daughter or as my sister. And so we have many, many different things that people will report as why they didn't like who they were and decided that they would start identifying as a transgender person. And so then they lived the life and realized it didn't take care of the pathologies, it didn't take care of the underlying issues. Now, what were they? One of the gentlemen I'm working with today, he was diagnosed with schizophrenia, bipolar I disorder, and PTSD. A gender clinic in California decided to remove his genitalia, give him breast implants, and tell him he's a female. That lasted 4 months until he contacted me, and he says, I want my life back. And we have a medical malpractice case working at the moment. But this is common for the gender clinics to just move forward with hormones and surgery and not look at the underlying comorbid disorders, no matter what they are. And that's really, to me, whether it's an adverse childhood experience, whether it's a social contagion, whether it's serious mental disorders. I've had children who've been passed around to foster care homes. Many of them just became exhausted with the whole idea and thought, just being transgender was better than just being a foster kid. And I've had individuals tell me, one in Palm Springs, California, said that I said, why did you do this? And he says, well, I'm in a family of 8 people and nobody knew I was there, so I decided if I identified as a transgender female that people would actually recognize I was there. So he lived that way for 2 years. He's detransitioned and he's back. So all of the issues that I have found actually were reported to us and kind of known many years ago. If you go back to, Quentin talked about Harry Benjamin, and Harry Benjamin had a clinic in New York, and he had an endocrinologist. His name was Charles L. Illenfeld, who was a homosexual activist who worked at the clinic for 6 years, transgendering and giving hormones to 500 patients at that clinic. Came out and told a bunch of clinicians, much like we're talking about here today, and he expressed to the clinicians the harm about giving people hormone therapy. That was in 1979, by the way. And he said that what he has seen with using the hormone therapy with this population of people who identify as transgender is there's way too much unhappiness and far too many of them end in suicides. That was in 1979. And then if you fast forward to 2004, July, you'll see where the University of Birmingham in the UK, aggressive research studies came out and said, it was reported in The Guardian in 2004, it says sex change surgeries are ineffective. In fact, they said in that study in 2004 that it actually elevates suicide risk. So that's in a UK study that was published by The Guardian in 2004. So my point about this is what all these great doctors and this amazing information that they put forward has been known for years. This is cutting people's genitals off or telling them they can become someone else when the doctors admit in a court document that you can't change your gender, you can't change your sex. People come to realize the harm that's being done by this. They can't produce children, and they can't be a mother or a father in many cases, or if they have fathered a child, they become so deeply depressed, I believe, from just talking typically to some of the people. They are so traumatized by the fact that someone lied to them and told them you can change gender and affirmed them and went down this path that ends up in ruin. So with all of the people, the thousands of people that I've worked with them as young as 12 to as old as 74, and they all have regret. The time period of regret, which is very interesting, is I've had people report to me in letters to me that they regret it 3 weeks after surgery. I've had several people report regret after 40 years of living that way, that it took them that long to actually get up the courage to realize that it was a big, huge mistake, and everyone will admit when they write me that it was the biggest mistake of their life. So the idea of giving people hormones and surgery when we've known about the harm since as far back as 1979, there's many testimonials about this. No one ever changed their gender. And the fact of the matter is that the individuals that I work with, when we actually go through what caused them to not like who they were, whether it was sexual abuse, emotional abuse, sometimes it's the death of a mother or a father. We had a case where a young boy wanted to transition to a female because his mother died, and he actually felt like if I identified as a female, I could keep my mother alive. That is some interesting psychological issue going on. So we know that there's the psychological impacts, the disorders are developed long before the people struggle with gender struggles. And so what I find in talking to them is they will report to me after they've kind of detransitioned, is they'll say, I never had gender dysphoria. It was never an issue. It wasn't about gender at all. It was about something else. So what we realize is that people detransition because of medical problems after surgery, hormonal problems after surgery. The second one is because of unresolved psychological, emotional, or sexual issues. And so, or it was, they mixed up the idea that it was a gender issue with when it was actually a sexual orientation issue. And so what we need is a lot better early studies into talking with these people and sitting down with them and actually finding out what their history was, what happened in their early childhood environment. And we could actually, I believe, begin to help people a great deal by stopping and doing the watchful waiting and do much more time talking to these young people and asking them, why don't you like who you are? And why do you think you're going to be better off if someone fills you with hormones or cut off body parts and you realize that, you know, you cannot produce children? Nathaniel, a young man from upper New York area, wrote me and said his parents helped him when he was 15 years old get hormone blockers, and they approved of it. They affirmed him all the way up to 18. They helped him on his birthday go to have surgery, cut off his genitals, got breast implants, did all that stuff. At 19, Nathaniel contacted me in an email, which I published in the Daily Signal. And in his email, he said, I feel like a Frankenstein monster. I want my life back. Can you help me? And I reached out to the community of people, and we got a lawyer to help. We had a lady that had a lot of money that was going to help him detransition. His parents refused to let him detransition. They wanted to keep control over his life. I asked Nathaniel, what happened that caused you to go through this process? And he told me he was addicted to pornography. Addicted to pornography. It had nothing to do with his gender dysphoria. He was addicted to pornography, which damages the brain and causes people to not be able to relate well to other people sexually or emotionally or psychologically. So my purpose here today is that these children don't need hormone blockers. They don't need surgery. They don't need hormones. They need a good, effective, loving clinician to sit down in front of them and say, how can we help you? Why do you feel this way? What happened? We're going to help you. And if we did that, we could actually help an entire generation of young people instead of engaging in institutionalized child abuse by cutting off kids' body parts and filling them with hormones and leaving them out to ruin who are going to write me and say, Walt, can you help me detransition? My life has been destroyed. I think there's been sufficient amount of information from the good doctors today, all of whom I know and respect, that anyone who sit quietly and listen to this and takes the information in realizes we have gone down an extremely bad path if we care about children. If we care about children, we will not engage in these harmful therapies that are destroying their lives. And I would love it if my website didn't get another click. I would love it if my inbox did not get another email saying, I have regret. Walt, can you help me? This is a crisis. We have the information. We have the knowledge. We have the research. Let me ask you, do you have the will? Do you have the desire? And do you have the interest to step up and stop the trans madness for kids? Because that's what needs to be done. I'm going to do it. Please join me and the other doctors. Thank you.
Wow. Thank you so very much, Walt. And thank all of you. And I'm pretty sure you heard a lot of information that you do not necessarily hear on an everyday basis. Because what we've all been told is that's really a piece of cake. You know, you can just change your sex and you, get double mastectomies, you get a hysterectomy, 15-year-old girls even. So we are operating on completely healthy young children who, as was pointed out, have no concept of what lies ahead. I mean, for very good reasons. They cannot legally enter into a contract because they lack the maturity to conceptualize what they will actually commit themselves to. But we are allowing them to decide whether or not to get a double mastectomy or have their penis removed. This is really how we're going to play this. So, the most staggering thing actually is, I asked earlier, I spoke to Walt very briefly, and I asked him and I asked you, what do we have numbers? I mean, how many people do we actually know of? Is there some databases that actually do regret having transitioned? And I was told there is no data. They're not interested in finding out what the outcomes actually are of their actions, of taking away these wrong body parts of healthy young children. They're not interested in that. And that in and of itself simply shows they don't care about people. They are not interested in their welfare. There's other things going on. Millions and millions of dollars of money can be made off of this. I don't know what other agenda is behind there, but one thing is for sure, it is not about the welfare of these children, no matter what they claim and no matter what they tell us. Because simply not being interested in finding out if that actually does help, that is a big tell. That is a really big tell. So I would like to open the floor up for questions now. So go ahead, shoot. I guess everyone's just stunned.
Congratulations for all the speakers you could invite today, because it's very important issue we are speaking, and is the proof of the huge courage the speakers and you yourself you has, because speaking about this problem from this perspective is the very big proof of the courage. And the courageless is one of the weak point of our civilization. So congratulations. It's not easy, I can imagine, to speak about this issue, especially here in United States, because we had the speaker from the United States. I'm Polish, and in Poland we observe this phenomena since a few years only, like 2-3 years, and it's shocking. Polish public opinion is shocked about all this issue. But I know that in so-called Western civilization, this problem exists since 10 or 20 years, yes. And the approach that is the problem, yes, it's a very correct approach. If you accept, I will pass en French language for 1 minute, okay? Si vous accepteriez, je passe au français pour mieux s'exprimer. Alors, le problème, je crois, pour des gens qui ont des preuves médicales, comme par exemple la personne qui a parlé la dernière, ce sont des preuves vraiment médicales, donc scientifiques, qu'il y a une voie erronée dont nous allons. Donc, aujourd'hui, la question est quoi faire avec ces preuves scientifiques, n'est-ce pas? Comment évaluer? Bon, la réponse la plus simple, c'est reconnaître toutes ces preuves scientifiques de la voie erronée qu'on essaye d'imposer aux jeunes aujourd'hui. C'est prendre de bonnes solutions politiques, n'est-ce pas? Parce que la voie démocratique normale est là. Si on a des preuves qu'il y a des choses qui vont mal, bon, on vote pour ceux qui peuvent le changer, légiférer, n'est-ce pas? Légiférer mieux. Donc, je finis mon petite intervention. Je suis ancien diplomate, donc je sais que les fonctionnaires font ce que le pouvoir politique leur demande. Alors, j'espère tout simplement qu'un jour, vous les hommes politiques, vous pourriez donner de bonnes instructions aux fonctionnaires et aux diplomates pour mieux légiférer ces problèmes, au niveau européen en tout cas. Et puis, voilà, il n'y a pas de questions, mais peut-être vous avez une réaction à cela. J'espère que ceux qui sont en minorité aujourd'hui, un jour, ne seront plus en minorité, c'est tout, voilà. Parce qu'il faut avoir conscience qu'aujourd'hui, avec une telle approche, nous tous, nous sommes en minorité. Merci.
Yeah, thank you very much. And you talked about, bravery. Well, don't worry about my reputation. It's ruined anyway. Since I always speak about things that, I don't know, other people don't speak about, but I consider that to be my job. So what you were talking about, civil servants, they will actually do what the politicians tell them to do. And, well, there is only one fix for that problem. The people need to realize they have to stop voting for those people, for those representatives that they do not care about representing the people. They serve some other purposes. So if people just realize they need actual representatives who actually will serve in their best interest, then the civil servants will have politicians giving them good tasks and assigning them good jobs and not telling them bogus stuff. So that would be my advice, and the people just need to realize that. So.
I would also say, all of you who are here, who heard things for the first time that you didn't know about, would look into the references on these slides. Don't say just because we said so that makes it right. I think there's an opportunity for you to dig a little deeper and then take this information to everybody you know. Do not be embarrassed by a conversation where it's politically correct to say something in a social group, and find yourself opening your own mouth and being an advocate for these children who really suffer greatly. And I would thank you all for that effort.
Just a quick mention, my lecture notes should be made available to all of you on the links. There's 62 references listed, and there's considerably more written than I had time to give you, and there's a lot to back up the information and to make it more understandable. So as Dr. Van Meter was saying, you don't need to take our word for anything. We've provided you the evidence. Et merci pour le commentaire en français aussi.
Okay. I intend and I hope that my slides will be made available with the video of this meeting. And I hope that that can be arranged. I really want them to be available to you so you can just show my slideshow, to someone, or you can show our videos of our presentations to your friends and colleagues.
Yes, thank you very much. I have one question. I mean, the medical evidence is pretty clear, and everyone who's not completely out of his mind should understand that there is a very high risk for children who enter the path to transition. So, but if I look at the field of politics today, it is so that let's say members of conservative parties are skeptical about all this transition, while for I don't know which reasons, members of, let's say, parties who are rather progressive or leftist, they are, in spite of all the medical evidence, more or less in favor of this. And do you have any explanation why this has become such a camp issue, that obviously scientific evidence doesn't play a role anymore?
I would encourage you all to understand that opposition is this working? Okay. Opposition to these gender-affirming interventions is a hands-across-the-aisle opposition. It's conservative and liberal. It's religious and not religious. We even have trans-identified adult groups that are strongly in support of making sure this is not available to minors. What's coming out of the UK, out of Sweden, out of Finland, l'Académie de médecine française. These aren't conservative religious people that are making these statements and putting this forward. So don't allow the pro-trans side to convince you or the public that, oh, it's just conservative religious people that are opposed to this. Not at all. It's an all-hands-on-deck effort. It's building slowly. Really, Dr. Van Meter in a documentary that we're both in that's on YouTube called Transmission, Why the Rush to Transition Youth. And the documentary closes with Dr. Van Meter talking about his conversation with Professor Paul McHugh of Johns Hopkins. And he's asking, you were there before and you helped shut this down in the early 80s. Now here we are 40 years later making the same mistake with kids. But how do you think this is going to end? And he says, I'll tell you when it's going to end, is when the families that went through this and came out on the other side, the kids and the parents, when they sue not just the doctors and the hospitals, but the insurance companies, the pharmaceutical firms, the biotech firms that are profiteering off of this, that's when it comes down. So the Bell versus Tavistock case was certainly, a bellwether case, and it's been very useful. But there's others coming. One in the United States that I'm personally involved with, so I can't discuss, is going to be extremely significant. It's just hit the press in the past few weeks. And it's the kind that Dr. McHugh was saying needs to happen. And there'll be more like that. So when the medical establishment sees that this is not a guaranteed cash cow, that there's very much going to be a cost now for chemically sterilizing and surgically mutilating able-bodied kids, that's when this starts to turn around.
I do believe, continuing with the same question, I do believe that the lawsuits will be very important to a turnaround. But don't assume that those who are pro-transing actually know the research. When Dr. Van Molen and I are from California, when our colleagues testified to our state legislature that puberty blockers plus cross-sex hormones equals infertility, they thought we were lying. The sponsor of the bill stood up and said we were lying. They didn't believe it. They didn't know it. So we got a hold of consent that parents have to sign that said this is true and send it to every member of our state legislature to prove it to them. And even in the World Professional Association for Transgender Health latest version of their so-called standards of care, they did have in their references the studies I referred to that say that the psychiatric conditions come first before the gender dysphoria. They didn't breathe a word about that fact. They just picked up some little, insignificant thing from the study that they said, like, well, it showed there's a high association of disorder, of having problems, and it completely were silent about the fact that they come first. They just jumped to saying, well, these psychiatric disorders are caused by minority stress and discrimination. Well, if they begin before gender discordance, they can't be caused by discrimination or minority stress for being gender incongruent gender identified. That doesn't follow logically. And yet that's what they do with the research you just heard today. They ignore that the disorders and bullying, evidence I didn't have time to get to, that a lot of the bullying in Finland, the children were the bullying was usually before onset of gender discordance. And so the evidence of psychiatric disorders and trauma causing gender discordance, they're silent, zip your lips, lock your lips, throw away the key. So don't assume that the people who are pushing transing actually do know the science. They're not hearing it.
Yeah, it's also quite interesting when you look at it, the focus, on the only solution for any number of problems seems to be, changing your sex now. So where have we heard that before? There is like no alternative for any problem anymore. Look at COVID. It was, the vaccine, the game changer. That was the only focus, and people were really forced, it was forced down their throats. You take any number of issues, climate change, there is only one solution. We have to abandon all the cars, of course. We cannot fly anymore. But this limited approach to problems is really the main problem, as I see it. So, because it leaves no room for any kind of research or exploring any other venues to deal with the problem. So.
Hello. I hear what you were saying earlier, that the solution may lie within voting, that we should vote for the right people. But the problem I have with that, when I think about my own country, Belgium, is that I am not aware of any political party that goes against this transgender political agenda. So the question I have is, what can we do as individuals to fight against this agenda? What kind of actions should we undertake, knowing that we have no fundings whatsoever, that we have no political power?
Well, first of all, I would advise you to turn off your television set, because it's making you stupid. Seriously. I'm totally serious about this, but because this is the brainwashing that's going on, the gaslighting. Like I said, only one aspect of a particular issue is being highlighted and is being pushed. And to your other problem, you do not know of any party that would fight against this gender madness, Vlaams Belang, for instance. But there's also an indication, if you didn't know, there was a party that actually goes against this. That is another, pretty much example of how these alternative voices, these other approaches to various issues are simply completely blacked out in all of media. So you kind of have to, get that information yourself. You have to proactively seek out that information. You simply cannot rely upon mainstream media delivering it to you, because they won't, because they want you to remain stupid.
I would also say to build a coalition of strangers to you, maybe that don't believe in many things that you do or believe in things that you find abhorrent, but part of them, like the radical feminist movement, is a wonderful place to go knocking on a door and say, hey, we're diminishing women to be non-existent. That, does that not bother you? And if you get a coalition together across several ideologies that normally would not be your best of friends, you might find that the word gets spread more effectively, and it kind of catches fire from little brush fires into a bigger fire, and then gets noticed.
Mm-hmm.
Thank you.
I don't know how this would apply in Europe. I can just say that in the United States, parents are finding out what's being taught in their schools, and they don't like it. And it doesn't matter what their political party is, almost. So they're getting active. They're going to their school boards. They're demanding to know what their children are being taught. During COVID, when their children are home, they saw online what their children are being taught. That was very big. They're very big to happen. And so now they're going to school boards to fight this. They're organizing across the states, across the country. It's getting huge. They're having a very big voice and creating a big movement.
See, and there was actually a positive side to COVID. I didn't know until yesterday, until I was told. Joachim, bitte.
I can tell you this is really true, what you are saying. The parents are awakening on these topics and also problematic topics we have in this society. And therefore, don't worry about that. The parents are aware of the problems. But what I see, and our friend from Belgium has a point, is that many people I'm speaking don't want to hear anything about all this stuff of transgender and so on. They don't want to hear it. Even the good-willing people, even the people who say, I normally agree with my positions, they say, it was 4 weeks ago or 5 weeks ago, I heard from the German Bundestag that there was, or from the government, there was a paper which says young girls, young boys should it was recommended that these young people should think on getting a transgender movement and wait for should take puberty blockers. I don't know what's that in English, and so on. Could I speak German? Is it possible? Okay, then I will change to German. It's a special theme and it's a little bit difficult. Die Bundesregierung hat tatsächlich empfohlen, dass sich schon Kinder, die noch vor der Pubertät sind, also vor der Pubertät, sollen sich überlegen, ob sie nicht eventuell ihr Geschlecht wechseln sollten, und wenn sie sich unwohl fühlen in ihrem Körper, sollten sie Pubertätsblocker nehmen, und sie bekommen diese auch, ohne dass sie ihre Eltern fragen müssen und so weiter. Das stand in einer Handreichung, in einer offiziellen Handreichung der deutschen Bundesregierung. Das muss man sich wirklich mal vorstellen. Und ich habe dann etwas veröffentlicht dagegen. Ich habe auf meinem Blog etwas geschrieben und dann habe ich eine seltsame Reaktion gesehen. Ganz viele haben diese Meldung gelöscht. Also meine Freunde, ja, viele, die mir zustimmen, haben diese Meldung gelöscht und haben gesagt, das ist so schrecklich, das ist so furchtbar, das wollen wir nicht sehen. Wir wollen, das ist wirklich wie die 3 Affen, Augen zu, Ohren zu und Mund zu. Das ist genau das Prinzip. Und ich glaube, da droht eine gewisse Gefahr. Die kommt nicht von unseren Feinden, was das angeht, sondern die kommt sogar von unseren Freunden. Und da müssen wir in der richtigen Art und Weise, denke ich, aufklären, schonend aufklären. Aber das ist Das dürfen wir aber nicht außer Acht lassen. Das ist echt ein Problem, dass unsere eigenen Leute dieses Thema ausblenden und nicht hören wollen.
Okay. I think that when we tell people the horrible things that are happening, it can almost paralyze someone. Like they can't act, they can't do it. In fact, as I'm an activist, I know I've testified before legislative hearings and communicated to parliamentarians, and I have frozen. Sometimes when I hear something that's coming out of our legislature in California, like I have to take a few days to recover. So I think it is very important you have to be careful not to just tell someone the horrible thing that's happening, but at the same time give them hope and tell them something to do, give them an action step. Like sign this petition, come to this parent, the parent meeting, or we're going to the board meeting, and give them one baby step at a time. Like, you make an activist a tiny baby step at a time. First ask them to just come to a meeting, like a school board meeting or something, just attend. Or just sign a petition, and they can be anonymous. The smallest step to start, and then gradually increase what they can do. But give them an action and hope. We can turn this around. Parents, everyone feels as horrible about it as you do and can't bear how awful it is. We're not alone. We've got to spread the word. When everyone knows how bad this is, we're going to all act together. Or something, give them the positive vision. We can do something about this, and here's something you can do. So they're not just frozen in horror. You see, turn that into action.
The other thing is to express it in a positive way, what you are for versus what you are against. So I'm often asked by families who they know who I am. So the people that come to me are parents who are divided. One parent wants to trans the child and the other does not. And so they come to me just to kind of, just placate the one who does not want the transition to occur. And I'm asked the question by the other parent, are you anti-trans? Well, what does that mean? Am I anti a child who's suffering this condition, who needs the compassionate help? And the answer is no, I'm profoundly pro-trans. I am an advocate for that child, and I want to speak for that child and what I know is good inherently. I mean, this goes to the core of human nature. And, you know what is good, and you can sort that out unless you're talked into other things, and you just use your own head and heart and present it that way and see if it just seeps in a little bit more. So.
Yes, please.
Yes, again, congratulations for these organizations of this event. And you said that we were searching for a mobile of the crime and searching and said, I don't see any other reasons than money. And I completely agree. But I think that, I don't know if you will agree, but that there are additional reasons, and all these subjects are connected. And another subject which is really connected, if that you agree with all these things, then you agree more or less with the idea of transhumanism, and that the future is the robotized man. If you agree with these ideas, then of course you agree that there is no difference between a man and a woman. If you agree with these ideas, you also agree with the new philosophical theory that narcissism, which was horrible things, is the next supreme value. And then you agree that everyone has to take selfie of himself, and that suicide is nothing. And I think that if all those people should perhaps make a convention or see from a higher point of view and see the connections between all these additional problems which are connected, because if you agree with all what we try to fight on a rational basis, then you agree also with pedopornography. And then all things are connected. And that was my first reaction. And then I'm also Belgian, and I completely agree with this citizen. I tried to make politics in Belgium, and I use the word tried because of this value, there is almost no single point to land and to develop these values in political parties in Belgium. But I think that perhaps a next step would be, and I'm almost sure, I'm not sure, but I've contacts in this sense, that there will be political parties which will perhaps, Belgian political parties, which will perhaps not develop those ideas, but at least will defend the freedom of expression, the freedom of the basic rights. And those parties, if they develop, at least we will be allowed to express this point of view and not to be jailed because of expressing this point of view. Perhaps I exaggerate. And also, if you live in Belgium, one thing which is very surprising, and I saw it always in the lobbies of this parliament a few minutes ago, is that the artistic value in Belgium is very low. Everything is horrible. And I think artists should develop another form of art. And all those people in paintings, in movies, in everything which is beautiful, has no expression anymore. If you go in a tube station in Belgium, it makes everything is dark. There is nothing, and you have no future. And I think this could be also a good idea to develop those things, but because we have no other choice, but it would be searched too far that immediately in Belgium developing those things. And another thing I always defended when I made politics is that I congratulate the European Parliament, and there are people expressing good point of view, like in a democracy, but people living at the European political level should not underestimate that your opponents know that the world has become a small village. And in this small village, what happens in the national parliament, which is far a few hundred meters away from here, that has an enormous influence, because all Belgian politicians, they say, we have voted it in Belgium and we are a democracy, and so we will impose it at European level and at all national parliament level. Sorry, yes, thank you.
Sorry, thought I did that. The two driving forces here for this transgender tsunami is, the economics, the profiteering, but also the underlying ideology. And sometimes they're together, and sometimes it's one leading the other, but they're both clearly there. And obviously, the ideology does have other implications as well.
I would like to read a statement first, and then I would take your question. Is that okay for you? All right. So, because there was another trans person scheduled to be joining us today, and initially she had agreed to coming on, but then realized that it might have repercussions in her job. So, and I completely understand that, because that's just how it works. There you have a trans person, not in line with the official narrative, and she would just like to help children not walking into the same trap, pretty much. And but she has to fear to lose her job, possibly over it, or being stigmatized or defamed or by her colleagues. So anyway, I had a very long, lengthy, pleasant conversation with her. And she even allowed me to ask some very personal questions, which I obviously will not discuss, because those were pretty much discussed in confidence. So she asked me to call her Susie, because she does not even want to reveal her name. It's by a trans person living in a European country. First of all, I would like to thank the organizers for conveying this message. I'm a trans person who transitioned male to female in middle age. That was more than a decade ago. My sex is male, and it will always be male. But after social, medical, and surgical transition, my body resembles a female, and now most people do see me as a woman. I live in a European country where the law protected me from discrimination, and I continued my professional career with very few problems. In most European countries, trans people are accepted and included, and think we should congratulate ourselves for that. However, I'm very concerned about gender identity legislation that has swept across Europe and clouded the thinking of many politicians. I worry very much about the late trans in Spain and the planned Gender Recognition Act in Scotland. These laws replace biological sex with self-identified gender identity. Objective scientific truth is displaced by subjective pseudoscientific feelings. Why? What happened to the Enlightenment? For me, being trans is not about having a gender identity, but the way in which I live my life. Indeed, I do not think I have a gender identity. If I can be trans and not have a gender identity, then why should anyone need one? But gender identity legislation attacks the rights of 4 vulnerable groups: women, homosexuals, trans people, and children. Expressing these views makes me feel like a heretic in a religious theocracy, where speaking out against the regime is considered to be blasphemy and punished severely. So rather than speak to you myself, I have asked for my statement to be read to you. Perhaps I should not worry, but I'm a socialist and I'm active politically. I respect Christine personally and for speaking out on this issue, but I'm opposed to the politics of her party. However, Christine knows who I am, and I trust her to keep my confidence. I also know that I should speak out publicly. My position in the socialist and labor movement would be at grave risk. Really, we on the left should be having this conversation openly and publicly, but instead any debate is shut down rapidly with accusations of transphobia and bigotry. Being trans is no defense against accusations of being anti-trans. What they mean is that I'm attacking gender identity ideology, and that is not permitted. Why is it not permitted? Because it is being used by the powerful to attack the rights of the vulnerable. Women, if anyone, can self-identify as a woman, then women's boundaries are meaningless, and it is impossible to protect sex-based rights. Homosexuals, if biological sex does not matter, how can laws protect gays and lesbians who are sexually attracted to the same sex? Trans people. When I transitioned, we had the legal protections we needed in my country. The right to transition, healthcare costs to be covered, and we were protected from harassment and discrimination. We transitioned and got on with our lives. There were few problems and little fuss. Now it is very different. There is suspicion and mistrust that has been created, I believe, by these laws that have replaced objective facts with subjective feelings. Children. Children are my biggest concern. They're being told a lie that they can choose their sex and whether they can grow up to be a man or a woman. Adults are also being told this nonsense, but children are building their lives on it. Some are being mutilated. Many more are having their mental health damaged severely. Children need to be left in peace to find themselves, not have identities imposed upon them. Maybe some children who identify as trans will transition as adults, but many others will grow out of it, and we cannot distinguish the two groups. And even I am pleased that I was never able to transition as a child. Had I done so, I would never have had my own children. They are far more important to me than any chemically altered childhood of my own. The transitioning of children must stop, and it must stop now. And governments must stop their obsession with gender identity legislation and refocus their energy on the job they're supposed to be doing, protecting the vulnerable. So much from Susie, and I really, I'm really grateful that she wrote out this statement. Like I said, I really respect her a lot, and yeah, she spoke out, even though she didn't do it in person, but under the circumstances, I guess it is, yeah, you could say she has a very good excuse for not having been here. Thank you very much. And I'm pretty sure she's online. Susie, love to you. Hello. Okay, are there any other questions? Oh, yeah.
Yes, I also want to thank you for organizing this. I think that it is so incredibly important. What I wanted to say was that there are already a number of parent groups across Europe who are organizing and who oppose the gender affirmative model of care. You've got Kyrjo in Finland, you've got Amanda in Spain, and in Belgium we have Cry for Recognition. So parents are already organizing. They want to know what they can actually do. And my question, I think, for MEPs in the room is what is coming up on the European agenda that we can engage with? I think one of the things that comes to mind, you can tell me if this is a good one, but Ursula von der Leyen announced that there's going to be a new mental health strategy, which will be dealt with in next year in 2023. And I was thinking that might be a good opportunity for individuals and for groups that I've just mentioned to engage at European level. Thank you.
Some of us who are speakers were able to be in a meeting where Susie was involved. And one of the concepts that Susie expressed was that not all people who identify as LGBT or T agree with the political agenda being carried out in their name. And she's one example of that. So there are these people like this. Some of them are willing to speak up. They are in the United States. They're speaking up. Some of them are afraid to, but they're very happy we are, and they're supportive that we are. So just as you're thinking of women's groups who may work with the protection of gender discordant children, there also may be, some of these groups may be some people who identify as LGBT. So you never know if you reach out to people who agree on this issue, even if on not others, who feel passionately about this issue, coming together across the aisle, that can be very powerful.
Would actually appreciate, you mentioned a couple of groups that are already pretty much up and running. If you could provide my office with a list, and I could, put it on my social media, so people would know, let's say in Sweden or wherever, who to contact, who to get in touch with, if they have questions or if they want to get involved or do something. So that would be really helpful. If you could help me out on that part. As far as the mental health strategy is concerned, we'll just have to wait until it actually comes out. But I guess it's not, I probably wouldn't be saying something wrong here. If I had to take a guess, it's not going to be good, because nothing coming out of this place is any good. So the problems they claim to address are never the problems they actually address. There's always some kind of an ulterior motive, a hidden agenda behind that. So I wouldn't hold my breath for this new mental health strategy, but we'll just have to wait and see what they come up with. But like I said, I'm not very optimistic. There any more questions? That does not seem to be the case. We are just about, should be wrapping up anyway. There is still some refreshments there, so please help yourselves. And I would like to thank you to be here. And I really hope it was valuable information that we were able to give you. I especially thank my experts. And I must say, once I started that project a couple of weeks ago, I learned a lot since then. And yeah, what can I say? I kind of had a concept of what was going on. I kind of had an understanding. In most parts, I was actually confirmed. I pretty much had the right idea. And I thank you so much for coming all this way to educate us, and that you continue to do what you're doing, because it's really important and the children need us. Like I said, I really don't have any words anymore to describe this. This is an atrocity, what they're doing to these children. So thank you again for coming. Thank you again for
Thank you,
educating us.
Christine, and thank you to all of you. Appreciate what all of you are doing.